Welcome on my Wisdom Teeth channel on Osteocom. Today we will talk about the surgical instrumentation we need for wisdom teeth extraction. Before looking in detail on the instrumentation, what did our old people say? That errare humanum est, but perseverare autem diabolicum. This means that we can make mistakes, but if we continue to make them, then we have a problem. This is to say that as oral surgeons, we have many skills and we have to have a lot of knowledge, but we also know that we can't always remember all the steps. And so a nice sentence was that before takeoff, it is a good way to guarantee an adequate level of safety to have some checklist. I suggest you to read an excellent book written by an American surgeon, Atul Gawande, with a book named The Checklist Propaganda, which has shown how the checklists have changed the approach in his everyday life. And so we have tried to do this also in our everyday life surgery. We know that we have a lot of knowledge, but there is a relationship between the number of informations that we have to analyze and the maximum attention available. And this makes a curve like in this graph, and we know that we can't keep the attention always at the top. So if we prepare with our team some checklists, then probably we can help everyday work go better. We have made some checklists with our Italian group and with an objective which is to prevent any possible mistakes during our surgery. These checklists have an anamnesis, so the general health of the patient checklist, a pre-op checklist, and oral surgery and implantology checklists. You can look at these checklists on our Italian website, where we have to see in the pre-op a certain number of things where we have to flag to see if the things have been done or haven't been done, like signing the informed consent, seeing and checking if the patient has had antibiotic therapy prescribed, and if the patient has assumed the antibiotic therapy, see if the patient has continued his normal drugs for his pathologies, look at any changes in the patient's pharmacological subscription. And so these information are very important to avoid the routine that we usually have before the surgery in order to avoid any mistakes. And so we will have some preliminary checks. The preparation of the surgical room has to be checked, and also the post-op phase has to be checked. For the preparation of the surgical room, we suggest some things that have to be looked by our assistants and by our working team before we start the surgery, because just imagine what would happen if we started the surgery, we had given anesthesia to our patient and something doesn't work, maybe like the straight handpiece or any other appliance that we have to use. So it's better to check the functionality of these apparatus before we start the surgery using some checklist, so that everybody in our teamwork can help us to reduce the risk of errors and mistakes. So we also have to check the presence of or absence of instrumentation that we maybe need for that kind of surgery, maybe some tweezers, maybe some elevators, or some particular extra fine levers to maybe go and catch some fractured apexes. So we always have to check beforehand, so before we get our scalpel and we start our surgery. This is a good suggestion I give you. By looking at our operative table for extractive surgery, we see that we have to lay our instrumentation with an ergonomic aspect so that everybody in the team knows which are the phases that we're going to see during the surgery. So we have the anesthetic surgery where we have our carpool with our vials, and then we have some either Cushing or Adson tweezers, our scalpel, Pritchard or Malt or Freer elevator, whatever you prefer, our levers, our spoons to remove the debris and particles at the end of the surgery, our mosquitoes or Klemmer tweezers. Then we have our Mayo Eger for the suturing phase, the scissors. This is a Bishop elevator to elevate and remove the lips. And this is our Langenbeck elevator, which we will see in detail further on. And then we have our straight handpiece with a fissure and a round burr. So, as I told you, this is one of the important aspects of the instrumentations of my surgery. It is a Langenbeck retractor. It has a very final atraumatic hook to load the flap and to protect the nobile structures. It is very important if you want to perform a minimally invasive surgery with small flaps to have very efficient instrumentation. We don't have to have thick and bulky retractors because this can't help us to have a small, minimal invasive flap. Otherwise, if we use a not appropriate instrumentation, we will tear the soft tissues and we will have less visibility during the surgery. So the important thing is that we have to have a thin final part, and this will have to perform its function without decreasing your access to the surgical site. And this is due to the presence of this longer area, which gives us access. And as you will see in the chapter of the lessons on the complications, we use this also to create a protection between our rotating bar and the underlying flap. So we see some intraoperative aspects of these elevators where we see that we can perform very small access flap due to the fact that we have very efficient instrumentations. Another important surgical instrument that I use is the bite block. This is a silicone prop that is placed on the contralateral part of the tooth that we have to extract. And it is very useful because it helps the patient to keep the mouth open. In reality, the patient closes on this prop and so can relax the muscles around the mouth, and also avoids the patient to close the mouth while we're working with cutting instruments in the mouth. And it is always and also useful because when we do our luxating movements, sometimes the patients tend to close the mouth and feels a little bit of pain on the contralateral TMJ area. And by having this prop, by closing on this prop, the patient avoids from having pain on the opposite side you're working on. The Pritchard periosteal elevator has a double function. It has a periosteal elevator with the fine part at the end, and it has a protective function where we have to protect the lingual aspect of the flap when we are using the fissure burr or the round burr. So we use this part of the elevator for the elevation of the flap and this part to protect the lingual aspect of the flap. And we can see this in the images where we have the flat part protecting our area when we're using some cutting instruments or some possible instruments that can go and give some injuries towards the lingual aspect. We use round burrs and fissure burrs on straight contrangle handpiece under constant saline solution irrigation. It is very important that these instruments have a good cutting efficiency, because otherwise the problem is that we're going to push harder to cut, and this can create overheating and also a lack and a loss of control, giving maybe problems of the instrument that can go out of control and go in the soft tissues. So these kind of burrs have to be quite new and have to be changed every so often, so that they have a very cutting efficient usage. Another kind of technology we use, it's the piezoelectric technology, and this kind of technology gives a very good quantity of advantages. It gives us precision because it has a micrometric cut given by the vibrating of the instrumentation, and this gives us the possibility to draw around maybe our roots and to draw around the part of teeth that we have to extract, and also to create space, like we see in this image, between the tooth and the bone without removing the bone, so being very conservative, very minimally invasive, and this creates a space where the tooth can have some space to be extracted without removing the overlying bone. Another very good advantage of this kind of instrumentation is given by the selectivity. If we see here, we are on the inferior velar nerve of a pig, and we see that if we touch with the piezoelectric instrumentation the soft tissue of the nerve, we don't create any tears on the any cuts on the nerve, whereas if we use the rotating instrumentation, we can have some lesions. Obviously, this kind of instrumentation has to be used with a correct learning curve, because we know that if we use the wrong insert in the wrong area, we can create damage. And also, if we put too much pressure on these instruments, we won't have a cutting effect, but we will have a heating effect, leading to post-op complications. So a good learning curve is important. Then another good advantage is given by cavitation. The cavitation is the passage of saline solution inside the vibrating instrument. This creates some drops of vaporized water that go on the bone and block any bleeding from the areas, so giving a very good visibility. And another main advantage of this kind of surgery, as we know, for example, from sinus elevation, is the cleavage. So it's the separation between maybe cysts or lesions like this in the surrounding bone with maybe some associated wisdom teeth, and you see how it is easy to remove these kind of lesions using the vibrating effectiveness of this kind of technology. So these are some examples of the inserts where we can have cutting instruments that have to be used on bone, and we know that we can't go with these cutting instruments on the soft tissues because we could create some lesions. These are extractive inserts which have to be used around the tooth. We can draw around our teeth so to create the correct space, and this, for example, is a less traumatic round diamonded insert that is quite superficial in its use, and it's created to make some plastic surgery around the bone and around the teeth. So very gentle and kind approach. Other inserts are, for example, these concave inserts that are used to create a space, a working space around our wisdom teeth. Also, talking about levers or elevators, we know that if we have an ergonomic handling of this instrumentation, we will not put too much force. One of the issues I always tell to our colleagues is that we don't have to put force when we are doing the luxation of the tooth. We always have to use like a 3-finger position of our hands on the handle, and we have to do some prolonged movements that are gentle but effective. We don't have to use these kind of movements with our levers, and we don't have to put too much pressure, because if we put too much pressure, we lose control. We can have different types of stems and different types of cutting edges of the final part of these levers. Another important instrument I use is the whortleberry lever, and this has a very good fulcrum. It has 2 working portions, a left working instruments and a right working instruments, and these are very useful to move horizontal impacted teeth, the terminal part of the root, towards the exit of the socket. So we first remove the crown. Once we have to remove the crown, then we will push the root towards the frontal part so that it exits the alveolus. But we will see this during the clinical cases. Clemmer forceps are used for different purposes. They can be used to remove tooth fragments, to remove bone fragments. They can be used for hemostasis by going and clamping maybe some small soft tissue vessels to reduce the bleeding, and also to remove any granulation tissue or the follicular tissue around our wisdom tooth once we have extracted it. These are some examples of how to use these kind of Clemmer tweezers. After seeing all this instrumentation, we have to point out that it's very important also to have a post-op patient office discharge checklist, where we have to sign our patient about all the instructions that we gave them for example, the diet, for example, the ice therapy, for example, the rinsage with chlorhexidine, and any other information we tell them. So we always have to check that they have their recall after 1 week, that we have prescribed the pharmacological recipe for the drugs they have to take after the surgery, and all of these information have to be jotted down on a checklist in order not to forget these important information. So I thank you for your attention, and I will see you in our next osteocom lessons.